The Keystone vision testing machines are extremely user-friendly, but you need to ensure that you follow these instructions carefully for all aspects of using the machine, including setting up the equipment, sitting down your subject, and the running and interpreting of the tests. If instructions are not properly followed, you'll run the risk of breaking the machine or gaining inaccurate results. To set up the machine correctly, start by carefully lifting it out of its case and placing it on a table. Do not lift the machine out by the more delicate viewfinder, but rather by its metal sides. Plug in the power supply unit and also plug the control unit into the machine, being careful to push it in the right way round. To open the machine out, release the magnetic catch and lift up the metal body. Now power on the machine. The LEDs on the control unit should come on, flicker and then stop at the first test, called Acuity Right, which we'll come onto in the testing section. The LED for day should also light up. The machine will also go through a rotational cycle whilst powering up. When sitting down the person you're testing, you first need to ensure that they're sitting on a chair at a comfortable height to the table. The participant needs to be able to comfortably look straight down into the machine, so the viewfinder will need to be adjusted to the right angle. All tests are given with both eyes open. The occlude buttons on the control panel for left and right eye are to be used for the right and left eye acuity tests on the rare occasions when it may be desirable to test one eye without the other eye seeing. Please see the instructional manual for more details on this. During testing, any glasses or corrective lenses normally used when driving should be worn. The different tests conducted on the DVS GT measure the ability of the eyes to cope with certain conditions and distances, and can be used to assess sight in relation to safe driving. There are 14 different tests in all, and the testing sequence demonstrated here is as per instruction manual. Our employer will now begin test 1 with our participant Steve. The machine will automatically start with this test.
Okay, Steve, I'm now going to run test 1. Can you look into the viewfinder, please?
Okay.
And just keep your head still.
Yeah.
That's it. Okay, now you'll see there's 9 boxes with numbers in them. Can you please read the numbers within the first box on the top row? That's box 1A.
1A.
Yep.
A is 5, 5, 7, 6, 4, 8.
Okay, thank you.
If the participant had identified at least 5 of the 6 digits in block 1A correctly, then he would be considered as having 6/6 or 20/20 acuity in the right eye and would not need to read further. However, Steve has got 2 digits wrong, so this test requires him to carry on reading the contents of the blocks, continuing across each row consecutively from left to right. A1, B1, C1, then on to the next line of A2, B2, C2 and so on, until he's able to read a box correctly. 1 mistake is allowed for blocks A1, B1, C1 and A2, as indicated on the record form.
Steve, can you please continue to read the next block? That's 1B.
1B. Okay. 4, 2, 8, 6, 7, 6.
Steve has now got only 1 digit wrong and can stop this test here. To move on to the next test, press the key marked ADV, which stands for Advance, once on your control panel. The LEDs will change to indicate which test you are on. Test 2 measures left eye acuity. Test 2 is identical in structure to Test 1 and should be conducted in the same way. Again, move on to Test 3 by pressing the key marked ADV once on your control panel. Test 3 is a binocular acuity test in night illumination. You need to begin by switching to night on your control panel. The structure of test 3 is also identical to tests 1 and 2, and again should be conducted in the same way. To move on to test 4, do not press the advance button this time, as this is the same as test 3, but in different light. You now need to switch to day on your control panel, and then continue in the same way as the previous tests. Now press the ADV key to move on to test 5, which is the left eye acuity test at 3 meters. This test is optional and it's for Group 2 drivers. To pass this test, your participant must be able to correctly read the contents of line 3 of column A. Test 6 is exactly the same acuity test at 3 meters, but for the right eye. The advance button does not need to be pressed, and now the left eye occlude button should be pressed on the control panel. Again, no corrective glasses or lenses should be used. Similarly to test 5, to pass this test your participant must be able to correctly read line 3 of column C. To conduct test 7, the advance button does not need to be pressed. The participant also needs to put any corrective glasses or contact lenses back on. This test will identify any problems with distinguishing between different traffic light colours.
Steve, what colours do you see in the 3 circles in column B on each of the 5 rows?
Each of the 5. Okay, is yellow, red, green, green, yellow, red, red, green, yellow, 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 red, 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 green.
Okay, thank you.
On the record form, colours are identified by their first letter. Following test 7, we advise that you now conduct the horizontal and vertical peripheral field vision tests, test numbers 13 and 14 in your instruction manual. The eyes may be tested separately or together.
Okay, Steve, can you just please stay with your eyes on the control panel? Now, as I'm conducting test 13 straight after test 7, I'd like you to stay focused on the coloured circles, please. What's going to happen is you'll see a light flashing either on the left side or the right side. So when that happens, could you please respond with left side or right side, okay?
Okay.
Use the control panel to show a 45-degree nasal field and to check temporal fields at angles of 85 degrees, 70 degrees and 55 degrees. Please note that the 45-degree test for the right eye lights up on the left side and vice versa. Do this test a few times for each of the various positions. To conduct test 14 next, the vertical peripheral field vision test, again do not press the advance yet. Conduct this test by selecting in turn from the control panel upper left, upper right and lower right. The lower buttons test the nasal field, down 35 degrees, and the upper buttons test the field 35 degrees above the eye line. Test 8 is optional. Please see the instruction manual for further details. For test 9, press the advance button on the control panel, which will now make the Fourier LED light up. The single slide for this test consists of a picture of a red dot and a yellow rectangle. The participant should be asked whether he or she can see the red dot and the yellow rectangle. He or she should say yes. Then ask whether the red dot is inside or outside of the yellow rectangle. To move to test 10, press the advance button and the LED for depth should light up. This test measures depth perception and sign recognition, all in the one slide. Firstly, the participant must identify all 6 road signs by describing what they mean. They then need to be asked to identify which, if any, of the signs appear closer to them than the others, and then which, if any, appear further away. To move to test 11, press the advance button and the LED for contrast should light up. You will also need to switch to night on the control panel for this test. Ask your participant to read the numbers in the first block in the top row box 1A. If they are read correctly, the participant has the ability to read a 621 acuity test at 10% contrast, and they do not need to read further. If not, they should continue to read across each row consecutively from left to right until all numbers in a block are read correctly. Please note that at this time no standards for contrast sensitivity have been set. If the test subject is unable to pass this test as set out here, he or she should not be denied a licence solely on the outcome of this screening. Press the Advance button to go on to Test 12, which should cause the glare LED to light up. Also make sure the machine is still switched to night. Please warn your subject at this point that you will be flashing a light in front of them. Explain that you will then be asking them to read a specified line of numbers immediately after the flash of light. Once the participant is ready and looking through the viewfinder, you need to flash the light by pressing the glare switch on the control panel. When the light goes out, your participant must read without delay the numbers in one of 3 lines you instruct. You need to measure whether they're able to read 6 or more numbers correctly in less than 5 seconds after the light goes out. When marking the results, for tests 1, 2, 3 and 4, you need to look at what you've marked in the test description column and then find the same data in one of the other 3 columns. This will indicate the acuity measure. For example, for test 1, if you've underlined 7.5 equals 4, 2, 8, 5, 7, 6 in column 1, the same sequence of number answers can be found on the right-hand side as 6, 7.5 equals 4, 2, 8, 5, 7, 6. So the acuity here is 6, 7.5. For the rest of the tests, marking the record form is straightforward. When interpreting the recorded marks for tests 1, 2, 3 and 4, it is a pass if at least 5 numbers are read correctly in block C of line 1. This is equivalent to Snellen acuity 6-9. For test 7, the colour vision test, all of the colours must be named correctly to achieve a pass. Any mistakes may indicate some form of colour blindness, and further examination by a vision professional may be advised. For test 9, the Fourier test, it is a pass if the red dot is seen as inside the yellow rectangle. Test 10, the depth and sign recognition test, is passed if both the closest and farthest signs are identified correctly. Sign number 2, the level crossing sign, as the closest, and sign number 4, the school crossing sign, as the farthest. For test 11, the contrast sensitivity test, a pass is achieved if the subject can read line 2 in column A. Test 12, the glare recovery test, is passed if 6 or more numbers are read correctly within 5 seconds of the light going out. Please note that at this time no standards for glare recovery have been set. Therefore, if the subject fails this test, he or she should not be denied a licence solely on this outcome. Test 13, the peripheral vision test, is passed if each eye can see both the nasal light and also the lights at 85 or 70 degrees. For test 14, the vertical field test, a pass is achieved if all lights can be seen. Under normal use conditions, the DVS GT Deluxe instrument requires minimum attention if it's protected by the dust cover when not in use. Virtually no repair or adjustment is needed, since all operating components are protected and solid-state circuitry assures exceptionally high reliability. The machine does not need to be calibrated, and it does not normally require annual servicing. Please refer to the manual for more details about maintenance. We will now go through some frequently asked questions and tips that will be useful for using your machine. If one side of the target is blank, possible causes are either that the LED lamp inside the machine is faulty or blown, which will require replacement with a spare as per the instruction manual, or that the occlude switch is faulty. If the machine and control panel do not light up when switched on, there are a couple of possible causes. The first is that the power supply unit is faulty if the green LED is not lit up. Replace the power supply unit with a new 12-volt Keystone AC-DC adapter. The second possible cause is that the link fuse on the main PCB is faulty or blown. When the machine is switched on, if pressing the advance and reverse buttons does not move the target, the possible cause is that the control panel is not connected properly. Turn the machine off, remove and refit the control panel, turn the machine back on and ensure that the green LEDs for acuity right and day are lit up.